question we get asked is, does it actually work? Well, we thought it's important to hear it from the patients who've actually tried this. They were kind enough to share their journey with us in the form of a testimonial. So here we have a patient who have been dealing with dry eye disease for many years now. She used to come to us for regular full eye examinations, for contacts, for glasses, and then she was introduced to the jet plasma treatment. Well, in her case, her dry eye was caused due to two main reasons. One, age-related. The other one was due to a corrective surgery that she had in her early 20s. What I like about this testimonial is the fact that how realistic she's being about this treatment. So she mentions that she had ongoing issues and it hasn't helped her 100%, but she did see a significant result and improvement after getting these treatments done. And that's usually what we aim to do. We want to make sure that we improve your overall light quality so you don't have to wake up in the morning and just start complaining about your eyes, or that to the point where you can sometimes open your eyes and it's painful. She liked the treatments good enough. She found them to be very beneficial to the point where she wanted to integrate it into her routine. And she keeps coming back, like Dr. Friedman said, every 6 months to get one maintenance session, or whenever she feels like she needs to get a refreshing session, and she goes on about her day without thinking about her dry eyes. Here's another patient who have been coming to us to get jet plasma treatment for the dry eye disease. What she says is very huge. She says that her dry eyes is pretty much out of her mind at this point. I mean, imagine going to a person who suffers from dry eye disease for so long, like I said, to the point where you wake up and your eyes already feel tired, dry, you get that burning, gritty sensation Dr. Barron was talking about, to the point where you can't really continue your daily activities and it starts bothering you so much. Imagine telling that patient there is a treatment that could help you to the point where you wake up and you don't have to think about these symptoms and you won't feel these symptoms anymore. I mean, that's huge. I would love to hear that if I was having these symptoms, for sure. So she also mentions that when it starts to bother her a little bit, that's when she knows that she needs to come in for a refreshing session. We call it jet plasma maintenance session. This is just one treatment you get maybe 6 to 8 month mark or once a year. It's like some patients, since it varies from patient to patient. So this is a good transition. Towards the end, she mentioned that she also saw a slight skin tightening on her upper eyelids. This is a great transition because we also use jet plasma for ocular aesthetics. So this device can be used to improve the loose or creepy eyelid skin that we see either on the upper lid or lower lid. It can also help with fine line and wrinkles and mild skin laxity around the eyes. This is huge because most patients only think that, or they have heard about this treatment due to the dry eye disease or the symptoms that they experience, but they don't really know about the ocular aesthetic benefits to this treatment. So in addition to skin tightening, we can also use this treatment to remove skin tags, milia, which are these small little bumps we get once in a while. I also have one right here, which I should probably speak to Angela, our medical esthetician, about, and styes or blocked glands, as well as these clusteral deposit, these yellow things around our eyes called xanthelasma. So beyond just skin tightening or treating dry eye disease, it can also be integrated into advanced facials. So like Dr. Friedman was mentioning, the whole idea is creating these micro pores on your skin using the direct current, and whatever comes after those, when those pores are opened up, when you get your facial done, we're able to get those, whatever it's applied to your skin, to be basically soaked into your skin on a deeper level because of these micro pores that are created on our skin, which is great. So here are some before and afters. These are our patients who we've treated. So this patient came in with concerns regarding the hooded eyelids. We can see that she received 2 treatments in total. And the after picture, which is at the bottom, is 6 weeks after her second treatment. So you can already see how lifted her eyes are just after 2 treatments. It's important to take into account that this is a gradual process. You don't just get it one treatment, wake up the next day, look in the mirror and be like, oh, I don't see any difference. This is because our skin takes time to heal, and for the collagen to build up over time, like I said, it takes time. So this was the results after 6 weeks from her second treatment. Here's another patient who came to us with concerns with the wrinkles and the texture on her eyelid. The skin is not doing the justice for the pictures here, but that was her concern. And we can already see how smooth the area is after just one treatment of jet plasma. So even though some patients come in for the hooded eyes or droopy eyelids, it can also be used for the skin texture as well as fine line and wrinkles. Here's another patient who came to us with the concerns of how her eyes are being droopy over time. And again, after applying jet plasma treatment on her eyelids, we can already see how her eyes already look much more open than how it was before when she came to us. So in addition to these skin treatments, we can also use it to, like I mentioned, for xanthelasma removal, which are these yellowish cholesterol deposits around our eyes. You can see the treatment does not damage the tissue around it. As we all know, the tissue around our eyes are very delicate, so we have to be very gentle with it. But we can see there's nothing left behind. You can even see that there was this cholesterol deposit before she had it done. Another benefit of it is the removal of skin tags. It could be around your eyes, anywhere on your face. And again, you can't really tell that this patient had these skin tags because there is no residue being left behind after we apply these treatments. And same thing with the small little bumps around our eyes, which are called milia. They can also be removed using jet plasma treatment, which again creates these micro pores in our skin and allows us to get rid of these annoying little bumps around our eyes. So what are the next steps? First, we need to make sure that we all are up to date with our annual eye examinations. Like doctors emphasized, there is a lot of components to it in terms of your treatment plan. So we want to make sure that your overall eye health is okay and your retinal health is okay. After we do that, we can book your dry eye assessment with one of our dry eye practitioners here to determine the main cause of your dry eye disease and to come up with a treatment plan that will work best for you. We have our medical esthetician, Angela, here, who'll be more than happy to answer any questions or book a consultation for a personalized skin analysis. It's free, so you come in, we take a look into your concerns and your face and determine what type of treatment plan works best for you.